Escalation of airway support, oxygen administration. Nasal cannula. Items 1 through 2 can be done in any order. Step 1, connected end of tubing to oxygen regulator. Step 2, turned on oxygen from 2 to 6 liters. Student stated range.
I'm setting the oxygen between 2 and 6 liters.
Step 3, place nasal cannula on patient with prongs correctly placed in nares and tubing gently looped over ears. Simple mask. Items 4 through 5 can be done in any order. Step 4, connected end of tubing to oxygen regulator. Step 5, turned on oxygen from 6 to 12 liters, student stated range.
I'm setting the flow between 6 and 12 liters.
Step 6, placed mask over patient's face and gently placed elastic strap around the back of the head. Non-rebreather mask. Items 7 through 8 can be done in any order. Step 7, connected end of tubing to oxygen regulator. Turned oxygen to 12 to 15 liters, student stated range.
I'm setting the oxygen between 12 and 15 liters.
Step 9, placed thumb over vent until reservoir bag was full. Step 10, placed mask over patient's face and gently placed elastic strap around the back of the head. Escalation of airway support, BVM ventilations. Step 1, assessor prompt. What equipment should be set out and checked for bag mask ventilation? Correct response?
Oxygen, an ambu bag, oral and nasal airways, suction, and a stethoscope.
Step 2, washed hands. Items 3 through 5 can be done in any order. Step 3, put on gloves. Verbalized if still wearing gloves from last skill. Step 4, choose appropriately sized mask, fits from chin to bridge of nose, and attach to ambu bag. Step 5, checked patient's mouth for foreign material and or small or ill-fitting dental devices. Note, good fitting full dentures may be left in place to get a better seal. Items 6 through 9 can be done in any order. Step 6, oral airway, corner of mouth to angle of jaw, and nasal airway, opening of nair to tragus of ear properly measured. Step 7, assessor states, your patient has a gag reflex. Selected and inserted appropriate adjunct, nasal pharyngeal airway, lubricated generously and inserted with bevel toward the septum with final placement following airway anatomy. Step 8, assessor states, patient has no gag reflex. Selected and inserted appropriate adjunct, oral pharyngeal airway curved up toward hard palate first, then rotated 180 degrees at soft palate, or Used tongue blade to depress tongue and inserted directly. Step 9. Attached oxygen with tubing and adjusted regulator to at least 15 liters per minute.
I've set this to at least 15 liters.
Items 10 through 12 can be done in any order. 10. Head tilt, chin lift performed. Step 11. Performed one-handed technique, thumb and index finger on body of mask, third and fourth digits on jawbone, fifth digits at the angle of the jaw, little or no pressure to the submandibular soft tissues. Step 12. Performed two-hand technique. Assessor should squeeze the bag for the student. Both thumbs and index fingers on body of mask, third and fourth digits on jawbone, fifth digits at the angle of the jaw, little or no pressure to the submandibular soft tissue. Items 13 through 14 can be done in any order. 13. Assessor prompt, what needs to be checked now? Student response.
Auscultation of the chest by another person.
Step 14. Assessor prompt, what must you do once the procedure is completed? Student response.
Document in the patient's chart.